So welcome. Thank you for being here. Again, I see some familiar names. Welcome back. I also see some new names. So if this is your first time, my name is Casey Venturini. I work in a program in the School of Public Health at the University of Nevada, Reno called the DEAR program, the Dementia Engagement Education and Research Program. And we have the honor at the DEAR program in supporting as serving as the institutional home base for the statewide Dementia Friendly Nevada initiative. I see I'm joined here by Director of the DEAR program, Jennifer Carson. Our third core member of the DEAR program team, Bradlyn Weissert, is just coming back from a well-deserved vacation. Otherwise, she would be here with us. But we are the Dementia Friendly Nevada support team, if you will. And each month we convene this online space as an opportunity to bring the highest quality education, the foremost experts to Nevada. Sometimes those experts are from within our state, as we are lucky enough to have be the case today. Sometimes they're from elsewhere. But these Dementia Friendly Nevada Distinguished Speaker Series sessions are meant to really support the work of our network of community groups across Nevada. Dementia Friendly Nevada, if you're not familiar with who we are, we have 9 different communities across the state that are working at the local level, bringing local community members together to take action to better support people living with dementia and care partners in their community. And we really see these Distinguished Speaker Series events as an opportunity to provide information that can be of real use on the ground and help to support the success of those local efforts. So please know, if you're joining us from outside of Nevada, that the information we share here are best practices, expertise, stories that are useful for everyone. No matter where you are. So even though we'll invite you to be an honorary Nevadan today, I know for a fact that this information will be just as useful for you to bring to your home community, wherever that may be. So without further ado, I will introduce you to our distinguished speaker today. And we are so lucky to be joined by Marie Coe, who is Nevada's state long-term care ombudsman. Marie is the second speaker in our series focused on innovations in long-term care to really support quality of life. And we are so lucky to have Marie here. Since her appointment in 2022, Ms. Marie Coe has led Nevada's long-term care ombudsman program with unwavering dedication to resident advocacy. She's been absolutely instrumental in shaping legislation that expands and protects the rights of individuals in skilled nursing and assisted living facilities. Known for her collaborative approach, Ms. Coe actively engages with providers, family members, policymakers to identify gaps in care and to champion solutions that meet the evolving needs of Nevadans. Her work reflects a deep commitment to dignity, transparency, and systemic change in long-term care, all values that I know we share at the through the Dementia Friendly Nevada Network. So, Marie, thank you so much for being here with us today. I will turn it over to you.
Thank you, Casey. Thank you very much, everybody, for inviting me today. And when Casey brought this topic to me, I myself got very excited to talk about it. And I think it's very relevant right now. And so let's get started. So innovation with heart and elevating daily life and long-term care. And as Casey said, I serve as the state long-term care ombudsman for Nevada. And if you've never heard of an ombudsman, we are advocates for people living in long-term care. And there is one state ombudsman in each state. So our goal is to advocate for the rights of people living in long-term care. And along with that comes everybody's unique perspective on how they want to be cared for. And technology certainly plays a part in that. So here's a little bit about me and some information that Casey has shared. And in addition to serving as the state long-term care ombudsman for the last few years, I've been with the program for 15 years. And so boots on the ground, working with the people in the facilities, as well as providers and families and our community partners. So over those years, I have seen quite a bit of change, which is a good thing for our people living in long-term care, but there's certainly more work to do. And that's where our partnerships come in. Some of the things that my office talks to providers about is the person-centered care. And so not treating somebody like a cookie cutter, not having everybody do the same thing at the same time, and making sure that that person has a choice. And so I like to say how you are living your life at home in the community should not change when you need long-term care. The habits and the patterns that you were previously doing. And if we think about it, when do we like to go to bed? When do we like to wake up? What do we like to eat? Simple things that are taken advantage of when somebody moves into long-term care. That's what my office strives for, is to have those patterns and those preferences met along with the care needs. And my contact information, should you want to get a hold of me or my office after this. And certainly collaborating and coming and speaking to you virtually or in person, my office, we encourage that. We like to share information and partner on different things, including legislation. And so a couple sessions ago, my office was very successful in getting several bills that improved the rights for residents living in long-term care. And a lot of the partnerships with our community providers were essential to that.
Do you want to put your picture up?
Yeah.
Okay. And the State Long-Term Care Ombudsman Office is housed within Aging and Disability Services. And so the agency, we honor the dignity of every Nevadan. And we've gone through a little bit of a rebrand in the last couple of years. And so there's some of that here. And if you look at the heart at the top, each color represents a different program within the agency. And so some of the programs that we have within the agency are Adult Protective Services, the Office of Community Living, our regional centers who support those with disabilities, our children's services such as early intervention and autism treatment assistance program. And so we serve the lifespan of the person, and that includes the Ombudsman program. Regardless of the person's age, we provide our services to anyone. So you might think of only older adults in long-term care, but actually we have children and minors with complex medical needs as well, who we go and advocate for. So today, we'll be going through these topics with the idea of creating comfort, connection, and joy through thoughtful innovation. And thoughtful, in particular, is person-centered. And so, again, the technology may not work for everybody, but it might work for one person and improve the quality of life for them. So we'll go over why innovation matters, what residents and families value most, some personalized engagement tools, voice-activated support, and smart living spaces, wellness monitoring, strengthening the family connection, empowering staff. Staff are a huge part of long-term care. Community life reimagined. We'll talk about some real stories and real impact, and then co-creating the future. And at any time, I welcome questions, comments through any of these slides. If something inspires you or you have something that you want to share, please do so. Okay, so why innovation matters. So innovation just isn't about gadgets. It's also about making life easier and safer and more meaningful. Families and residents, they want reassurance that technology serves people and not the other way around. Residents living in long-term care, they still want to be a part of the community, and they want that technology to help enhance their independence. It should also strengthen family connections and, again, support staff. And if staff can harness technology to save time, this will allow them to spend more time with the residents instead of doing the paperwork and all the regulatory requirements, if that part can be easier. And so our goal a community where residents feel supported, connected, and truly at home. The long-term care settings should allow them to be at home. And so if you think about some of the things that you have at your home right now, so some of us have a Ring doorbell camera, digital alarms in our house. So some of those things can also be implemented in long-term care and should enhance. Okay, so what residents and families value most? These values should guide every innovation, and this helps residents and families feel seen and understood. So if you think about, this is interactive activity. And so if you think about what is meaningful in your life, think about your day, think about your weekend. What does your morning routine look like? What's important to you that you just cannot do without? And then imagine that being taken. And how would you feel if you didn't have the technology to talk to your loved one who might live 3-4 states away? You would be isolated, depressed. And if somebody comes in and is your caregiver, your care needs might be met, but that part of yourself is not being met. So there's lots of technology around us and around our house. Some of the things that the Ombudsman program has helped to get for residents, as simple as tablets, an iPad. This allows communication with loved ones, could be voice activated. So if somebody has a physical impairment where they can't be pressing the buttons, they can use voice activation. And what about the daily needs of somebody? How about a virtual selection of choices? Pictures versus words. And when we're aging, we might not have the words. And so a picture might be an option to get our needs across. And at this point, there was a bill a couple sessions ago, and then it actually expanded into the residential settings for communication devices in long-term care settings. And so this is something, there is a lot of regulations around this, but if the person wanted something like this, then it is allowable now in the settings. And the choice of device. So Nevada, when this was brought to the legislature, one of the things that my colleagues in other states said was, make sure there's a choice in device, because if there's one type of device, but it's so expensive, it's unattainable, then that's not going to be good for the people served. And we already have devices. So why can't they be used in the setting that we're comfortable with? And one thing that really brought this to light was COVID. During COVID, people were isolated. People could not come into the facilities, and residents were not going out of the facilities. And so it allowed people who were not thinking about the level of isolation without the communication and access to loved ones, their families and friends, and any activities that they wanted to be doing, they could not. And so now a focus on technology to not have that happen again and to have these laws changed has been happening with the legislature. All right, so personalized engagement tools. So some technology, again, adapt to the person's interest, but some examples of tools that could bring joy and stimulation. A resident hearing their favorite song. It can recall memories and good times when they were at home. Some of the interactive abilities to keep the person's mind stimulated. On the technology, there's a lot of different apps now. You can put them on tablets or cell phones, and it keeps the person engaged. And the technology also allows those settings to be adjusted. So enlarging the text, brightening the screen to be able to be engaged in long-term care. Sometimes you just see the person sitting at a TV all day, and that might not be what they want to do. but there might not be anything else to do at the moment. And then one thing that I like to remind the activities directors are virtual tours. And so if you've ever heard of this, they have a place that you want to go. So we want to take a trip to Italy. We're going to make a trip to Italy for all the residents, and they have the food to go along with it, and music, and dress up. And so the technology allows these virtual tours of different places where the residents who they might have been to these places that can share, or they might have wanted to go to these places. And it gets them in a different mindset and thinking and having group activities together. Okay. So some voice activated support. So a lot of these items you've probably seen or you have in your house, and they can do a variety of things. And so you can call them for assistance. So using this technology to communicate with a caregiver, a resident and a caregiver. And so that way the caregiver's not coming to the room, seeing what they need when they push the call button. And so it'll make the caregiver more effective and the needs met of the resident quicker. These devices, you can play music, audiobooks, controlling the lights and the temperature. So the technology has also improved from just a music box and the Alexa to talk back to you to controlling some of the smart devices within the house. And that could be the same in the residential settings. So lighting especially with the smart light bulbs. And tools, these tools should be able to be used independently and accessible. Again, voice activated, and if the person is struggling, then things can be preset on these devices as well. So if they like to listen to music at a certain time, then you can set these devices for a certain time to have music when they want to go to bed. So lots of variety with these devices to choose from. Okay, so moving along to some additional tech, smart living spaces. So some innovations, the automatic lighting. And again, we talked a little bit about smart bulbs, that they have different colors. And some people, depending on what's happening with them, they might be not able to see certain colors. And so taking that in mind, but the lighting is good because it will help the person if they're getting up in the middle of the night, prevent falls. And it's a soft lighting where it should still not disrupt sleep. The automatic opening and closing of curtains. So those curtains opening at a certain time in the morning and helping the person to naturally wake and get up for the day. All right, so then some gentle reminders. So again, the goal is to help make the person as independent as possible. And so some things like medication reminders during the day, having the watch, you watch with reminders, it'll buzz and provide that reminder to somebody. And reminders about activities of daily living, such as showering. Sometimes we're not really doing much going on, and so we forget to shower. And so having that alarm and to remind to be able to do that. And also improving communication between the person and the caregiver again. And so having a touch screen or a communication to the caregiver where they're at and providing assistance timely. And here's some wellness monitoring. So you might be familiar with the Apple Watches. And so you can track your sleep patterns, the movement changes, if you're tossing and turning during the night, and the hydration reminders. Hydration is one of the most important things in older adults, and often forgetting to drink water and stay hydrated. So having these reminders are not only good, but can help prevent hospitalizations, and all of this while respecting the privacy of the person. Okay. Strengthening family connection. We said earlier this was one of the most important things to prevent and avoid isolation and reduce depression. And families also tend to feel more at ease when they're informed and connected about their loved one's care. It will reduce worry and builds trust with where they're at. And families who live far away, they can stay informed and participate in their loved one's care and their lives. And seeing that person through video is more personal than a phone call, can help to orient the person who might be experiencing some confusion, and that visual interaction can help. And the photos and message sharing, they can receive photos. So if their families are out and about and taking pictures and they might be on a trip, they can receive all those pictures. And then again, ease of video calling. So I know sometimes it's hard to get the call to go through, but having that call be received by the person. So if there's a scheduled call, they can receive it with the push of a button. And staff are a big part of the innovations in long-term care. And so empowering staff, making sure that we're looking at technology to simplify the documentation versus handwriting all of the notes and putting them in a binder that then goes on a shelf. And so the more that we can eliminate the printed documentation and work towards timely documentation, it'll improve the communication between the staff and regarding the resident and the resident's needs. Any changes that are going on with the resident, they're not having to wait for the shift before to update the notes so that they can be informed on the current status of the resident. It also leads to early insights into the resident's needs. And so if there's something going on, the resident has some change, then everybody can be informed on a platform that can be using technology to your advantage. And this is even true in social services. We are greatly needing technology to help us with cases and the time spent on documentation versus the time that we all want to spend with our residents. And so keeping in mind that reduction in paperwork increases time spent with residents. So there is not a list, and that was part of the legislation, was to not have standardized acceptable devices, because other states, this is something that was brought up, other states would have, these are the acceptable devices. They were extremely expensive. And for somebody, a resident in a skilled nursing facility who has a very low, limited personal needs allowance to buy anything, it was never affordable. And so that was a important piece, was to have a choice. So if it's a cell phone, if it's a Amazon Echo, it's a something similar like that, where it would not be outrageous. So which is what other states did, and it was thousands of dollars to put these devices in and have them installed and monitored, and so that was an important part. So there, I'm happy to say there actually is no list, but anything, just think about what's in your house, anything that the person can use. And now there is some regulatory requirements for cameras that are mounted to protect the privacy of the person, and also who can access the footage on the cameras. And when there are also the interviews, such as with the Ombudsman, Adult Protective Services, law enforcement, then that all is privileged. And so those devices would be turned off during that time. And I'm happy to provide some information on the regulatory information, but in regards to devices, we want a variety. We didn't want to limit it. Okay, so community life reimagined. I love this picture. But some of the ideas, so digital bulletin boards. So the residents can see what's happening today. And for staff, it can be updated instead of having, a lot of times we have the printed or the dry erase boards. So digital boards allow them to be updated and changed quickly. activity reminders. So activities that are happening within the facility, send all that to the devices. So if the residents have devices, they can get that information digitally. They don't have to go into the hallway where the activity calendar is, or if you have, the printed list and it's posted, then they can get it and make a choice to attend. And some robotic companions. So this, I was a little hesitant at this at first, but it's actually branched out in a lot of different areas. And so we have the robotic animals and the different things that have people have used. But if you think about in the community, the restaurants are also using some robotics to deliver food to your tables. And so why can that not be implemented in long-term care and have, the kitchen staff be cooking food and serving people and communicating with them, and the robot can deliver the food and walk it out. So I thought that was a good way to use robotics. So, and the important thing again is just making sure that the residents stay engaged and informed with the community with these robotics. It is not to make everything easier for people around them, but to keep the person engaged. Okay. So real stories and real impact. I'd love to hear from anybody if you have examples of how technology has been successful in anything that we have not talked about. No, we're not directly working with them, but we do work with several groups for persons who are blind, deaf, hard of hearing. There's different organizations, and ADSC actually has some grantees. And so we're actually increasing our community collaboration to make sure that there is accessible devices for this population in long-term care as well. The assisted technology office in Nevada, it's actually within ADSD. We just don't partner with them directly on this initiative. We definitely work with our populations to a lot of independent settings to make sure that they're supported to help remain independent.
I have one. At a community I previously worked for, we had a lot of luck using Oculus, so the virtual reality. And just especially for people that had an interest before and they couldn't, their mobility was no longer there. I know I had a woman that was, I think she was like pre-Olympic swimmer. So she was so into swimming. And so we put the Oculus on her and we had like a pool scene. It was like a swimming thing. It could also get some exercise and react to you. And she was it just brought so much back to her. And she started talking about, what she used to do a long time ago, and her mood was so elevated. And it just really worked with a lot of people if we really found out what their interests were and before, and what would make their life better now, like being able to interact with again. It didn't work with everybody because it's kind of hard to put on and stuff, but when it reached that certain person, it made just a huge difference. And sometimes we would pair it like with other senses, like with a food later, that if they did a tour of Italy, they used to live there, and pairing that with something that if you talk with a family and know something that resonates with them, and also having scents, like a smell in the air, like we would try to pair it with something that we could have aromatherapy as well. It really worked.
I mean, it looks like we shared in the chat as the power of some technology as simple as things like radio, as being able to provide music when you want it for as long as you want it, and I mean something like Sirius XM too, given a full range of options of genres. You can find whatever you want whenever you want it. That's the sort of technology I think that can really meet people where they're at.
And wireless headphones. I think those are great. So you're not connected to a device.
Easier to dance.
Yes, exactly.
I'm
Yeah.
sorry. And then I'll be quiet. But I just have to say, I'm so grateful you said wireless headphones. Just working with people living with dementia in residential settings, I've noticed that the musical or television enjoyment in one room often creates a total disruption, and can really generate a lot of discomfort for the person in the next room, especially as people lose some of their hearing. And they got to turn on that TV really loud. It just seems like one person's enjoyment often infringes on the rights and enjoyment of the person next door. And so, yeah, headphones are wonderful if
Yeah.
people would use them. Yeah.
Definitely. Yeah. And it's something that's small. We forget about it, but it's affordable, it's accessible, and they make a lot of different kinds. And if we think about, they're not only the Apple, things that all the teenagers are wearing all day long. I have teenagers, so I can say that. And the ones that go over the ear that can fit a little bit better, the cushioned and comfort. So there's also variety in a lot of technology, and that's where it should and can be unique to the person. Okay, so co-creating the future. In order to get any type of change going, especially in long-term care, feedback and collaboration is essential. So talking with the residents about what they want to see, what do they think can be improved? And residents have great ideas, regardless of where they are at. And the families, what did the family see when they were in the community that might be able to be brought to the setting? And start with the pilot program. We don't need to implement all tech at the same time. One small thing and have people get used to it, try it, and then start expanding. Making sure there's ongoing collaboration with the residents and families in the community. There's lots of different organizations that might have ideas that can partner and help facilitate. And again, make sure that everything is personalized to the person and that the person can access it and understands how to use it. And getting the community excited and involved. Innovation needs feedback from the people served and families on what would improve their quality of life. Thank you very much for inviting me, and any other feedback and questions, comments, I am here.
Thank you so much, Marie. I'm sure we have some additional questions. Would anyone like to pose a question for Marie, a true expert in innovation in long-term care?
I'm trying, just like everybody else.
Marie, I had a question. I'll start us off here. Maybe give some folks some time to think. I really love what you shared. Well, and the through line in the technological innovations that you talked about was about communication and connecting people. And I wonder, are there any innovations, technological or otherwise, that you've seen that have helped to support staff to staff communication, and collaboration among the professional members of a community?
Yeah, I have seen technology. So if you just think about your cell phone, the work texting apps about who are you going and helping right now? Can you come on this call and help me? I have, Mr. whoever who needs additional help. And we really the ombudsman program supports consistent staffing. And the reason why, and I know in long-term care it is hard, but when the residents get to know that staff member and their schedules and their routines and the things that make them who they are, then that's also better for the staff. And communication between other staff members, you can communicate how that person's day was. And if they're having a rough day, they might need extra support on that day. And so technology helps communicate that versus a 15-minute huddle at shift change where you're not going to get everything out. And so it's real in the moment, and has been successful. And again, a lot of providers have so it's not your personal cell phone that you're having these conversations with, it's the protected devices that protect the person's information. There's two settings that come to my mind, and so a young adult who's aged out, and like I said, the ombudsman program, there's nursing homes that serve people of all ages. So they could be five and have complex medical needs and be in that setting, in addition to a 90-year-old who's aging and has, skilled nursing needs. They could be in the same setting. But we have additional settings in Nevada for persons with developmental disabilities. And so there is some supportive housing for them as well. And they certainly age in place in these settings. So it just depends on the needs of the person. We do not. So there's case managers through the regional centers, and the regional centers are all housed within Aging and Disability Center services. And so they have case managers, and then the quality assurance who looks at the providers of those settings as well. The ombudsman, we on occasion can go in and do investigations, but that's not within our authority for routine access. Yes and no. I think it's very much in the infant stages. We're certainly talking about it as it pertains to long-term care and how we look at our data, our ombudsman case complaint data, and a lot of that has to do with low staffing, needs not being met. And so how can technology improve this? And so we talk about it on that level. But I think you're giving me a good idea for a conference idea. It is important. It is important, and we're moving in that direction in a lot of different areas. And so I fully support it.
Well, I'm grateful that you are leading the way there, Marie. It's funny, just I think about if I needed long-term care, I would want to be able to listen to my music, stream my shows, and it makes you all of a sudden you're making me wonder how many televisions in skilled nursing enable streaming. I would like to be able to order Grubhub from my phone or food delivery, which opens up a universe of personalized dining options, for folks who are used to using technology. But as the times are changing and we see a different cohort of residents in nursing homes, these are important questions for us to ask now so that we can be better prepared for the future. Because I can't imagine, like many of us here on Zoom, but I don't even know how I'd manage my life without Zoom. Like there's been a very significant technological shift in the world. And so I'm glad that Marie is our state's long-term care ombudsman. You're keeping up on, how do we help people stay connected?
Yes, definitely. And part of that is educating our legislators about what people in long-term care need. And so that's why, these conversations are very important and very personal. And one of the slides that I put on there all the time is, what does your day look like? What, if you had a piece missing, how would that impact you? And for many of us, it's significant. No, it's important. And I think sometimes people forget that piece of it. They are real people that need care, and they still have the same needs that they had when they lived in their house. They still have the same desires, and there's no reason why they shouldn't be able to get that.
Casey, I loved your comment also in the chat box from Michelle Daniel at the Eden Alternative. Could you just share a little bit about that? Because that is just there's wisdom, I think, in her guidance there.
Yeah, Michelle. So, for anyone who wasn't here last month, Michelle was our distinguished speaker for January, and the full presentation is available on the Dementia Friendly Nevada website if you'd like to watch it. But Michelle discussed the importance of considering individual utility and applicability for any innovation, right? And actually, Marie, you mentioned this at the very beginning of your presentation too. You said uh, technology might work for one person and it might not work for everybody, but if it works for one person, well, that's value added for that one person. And Michelle really took the same lens to thinking about things like the robotic companions that you brought up, Marie, about saying, if there are people who want those robotic companions, who understand what they are and who want them as part of their lives, then that's great. And we should make those available. If there are people who want real pets in their rooms and, want real kids to come and hang out in the long-term care community instead of a chatbot, instead of that sort of mocked up an intergenerational setting, then we should support that as well. Right. But how do we create systems that allow for that level of individuality? That's and I think that I could really tell that that was also the philosophy that you were bringing, Marie, as throughout this presentation, is really how can we make innovation serve each person.
Yes, yes, and making sure that there are not laws put in place that restrict that. And so the more that we talk about it and advocate for that, then people should have that.
Any additional questions for Marie?
Thank you guys very much.
Thank you. We are so appreciative of you offering your wisdom here today. Certainly for anyone in Nevada, I know that Marie's office wants to be a continued resource. So as questions come up, I will make sure that your contact information is clearly available for everyone to follow up. For anyone outside of Nevada who's looking for really forward-thinking approaches, I think Nevada can serve as a great example.